All right, everybody. If you're new here, my name is Rose Griffin. I'm a speech language pathologist and a board certified behavior analyst. I split my time between an ABA type center and a public school. So I always get asked a lot about navigating speech therapy and the field of applied behavior analysis. And I thought it might be nice just to throw together a webinar with some of the questions that I get often and have heard from you guys. I've gotten some emails leading up to this, and so I want to make sure that I cover everything because I think it can be like a really tricky situation to know how to kind of bring the two sides together and make everything kind of cohesive and work nicely together collaboratively as they should. Easier said than done. So if you're new here, I am a speech therapist and a board certified behavior analyst. I've been a speech therapist for 16 years and I've been a board certified behavior analyst for 8. So I really love being dually certified. There are less than 405 people now internationally and here in the United States that have both certifications. So I love being able to help my clients in a very specific way. And I love now with ABA speech to be able to work with professionals from both sides, speech therapy, applied behavior analysis, and parents, and be able to help them in a very specific way and to be able to kind of see both points of view and to help everybody kind of meet in the middle and to help our students find their voice. I really love working with all students. I love the field of speech pathology. I really do love working with students with autism, and I really specialize in working with students who are having trouble finding a way to communicate with the world, students who have behavioral barriers, and that's really what I love. I love being able to help those students find their voice. So this is a little bit about me. About 2 years ago, I created a product called the Action Builder Cards, which helps students learn language in a systematic way. And then about a year ago, I created another product called Double Up, which is geared towards students who are older, and it works on functional vocabulary like hygiene and leisure vocabulary and in social skills turn taking. And then when I'm not doing all things related to ABA speech, I am a mom to 3. So those are my kids. We're doing story time there with a new book by Todd Parr, which I love Todd Parr. If you haven't heard of him, he's great. And I love coffee. I mean, who doesn't, right? Who doesn't love coffee? So one of the main things with working as a speech therapist and a BCBA in an ABA type environment, the things that I tend to see are that you may have trouble as a speech therapist and a BCBA seeing eye to eye. So that's my little disagreement icon there. It's not that easy sometimes when you've learned something a certain way, when somebody presents a new idea or a new way of doing something or something you hadn't thought before. Sometimes we may be looking at one problem the student is having, but we're coming from different angles. And so not seeing eye to eye on things is something that I tend to see often. Another thing that I tend to see a lot is people not sure of what their role is. I had a job, an amazing job down in Austin as an autism facilitator and support specialist. And one of my main jobs was to go to our monthly speech therapy meeting and talk to the speech therapist, a group of about 35 individuals. And one of the things that would come up often was, what is my role on this team? If the teacher is running, intensive teaching trials, what should I be doing during my speech therapy time? How can we work together, even though there's overlap and shared goals? What are the different roles of the different people on the team? And I think that can be daunting for a lot of people, especially when the field of applied behavior analysis and speech pathology, oftentimes what we're working on together are shared goals, which I think is really great. And we're going to talk about my philosophy on that and how I apply that in my daily practice. But I think when things kind of overlap, it can get confusing on, well, what am I doing here? When we come to an IEP meeting and there's 20 people and it's litigious and, things like that. And maybe we're in our own setting, we're kind of, having little disagreements about what our different roles are. That kind of role expectation, I think, is very important for the team. Just so you know, you're making a difference every day. If you're working in a center that is geared towards applied behavior analysis, just know that applying the science of applied behavior analysis, you're really helping change lives every single day. When you help a student increase their leisure skills. I had a student that was learning how to play Connect 4, and we worked on it in individual sessions, and then we generalized it to a peer. And then I saw the student also for outpatient therapy. I got to talk to the mom and said, hey, we're working on Connect 4. It was modified, just I put in a red, you put in a black, and that's how we do it. And it's turn taking. That student was given Connect 4 for Christmas and was able to play it with his sister. So just know that every day when you're working and using applied behavior analysis to inch along and to help make progress, that it's a ripple effect. You're not just helping that client, you're helping that client's sibling have a stronger relationship. You're helping that client's family have a stronger relationship too. It can get hard in the day-to-day because it can be very daunting and overwhelming at times, especially with behavioral barriers, but you are making a difference. Okay, so I wanted to go through some of the tips and strategies that I have found very helpful navigating speech services in an ABA setting. So number one is build rapport with staff. I know that this can seem like a no-brainer, but sometimes when we're super busy, either if you're listening as a BCBA, clinic owner, or a speech therapist, there are a lot of people on the team for students with complex needs. So merely knowing everybody and what their role is very important. If you're working in an ABA center, does your student get any other outside service? That's important. I remember one time I was doing a local talk here about autism, and I was talking about collaborative services, and I really had a good communicative relationship with this particular parent, and I didn't know that right before this webinar or this talk I was doing, that my client was getting outside speech therapy services. It just wasn't something that had come up in my weekly dealings with the parent. It wasn't like it was a secret, but it kind of made me feel bad that I didn't know that. So being able to ask those questions, is your student getting any other services? It's good to touch base with those people and communicate with them. That's very, very important, because you need to know. You need to know who your child, your student is working with. It definitely takes a team to make a difference in the life of a student with more complex needs. Another thing to think about is learn about your work setting. Has your work setting had speech therapy services before? If they haven't, this might be uncharted territory. And some of the questions that people had submitted before the webinar, which I'm not a clinic director, so I don't have answers on billing and insurance and things like that. But those are things to think about. And if you are this first speech therapist that perhaps an ABA clinic is going to have, you need to think about, are you going to be on staff? Are you going to be a private contractor? And what I've seen here regionally is that typically if the program is growing and it's new, that person is usually brought on as a contractor. And then as the program grows and the company grows, they become a salaried staff member. That's just what I've seen here regionally where I live here in Ohio. Because if the clinic hasn't had speech therapy services before, they're going to want to ask you things that, how are you going to work cohesively with the other members of the team? How is billing going to work? And those are things that you guys can navigate together. As a director, where do you find someone who is trained? How do you find a speech language pathologist who is trained in applied behavior analysis? Now, with that being said, the Facebook group SPABA is dedicated towards speech pathology and applied behavior analysis. And there is a list of people who are duly certified by state. So that is something you could post on that Facebook page or even look in the files, and you could find people that way. With that being said, there are only about 405 people right now as of me doing this webinar. I believe that number is correct, in the United States and internationally, who have both those certifications. But that doesn't mean that you're not going to find somebody who's a speech therapist who wants to learn too. I mean, I remember when I first started in an ABA setting a really long time ago, when I first started in the field, I knew that I loved working with kids with autism. And I knew that I really loved applied behavior analysis because I saw the power it was having in the students. I remember thinking, whoa, this is really amazing. It's really helping my students increase their skill set. I would attend local, here in Ohio, we have an amazing local autism conference called Milestones, which is now a 2-day conference. And we've had really great keynotes. This year was Michelle Garcia winner. In the past, it's been Pierre Gerhardt, Paula Kluth. We have really, it's a great conference. But that's a great place to meet people too. Perhaps if you're a clinic director and you want to find speech therapists who are more behaviorally oriented, perhaps having a booth or just going to your local autism conferences, because that's where I was hanging out and now I present at those conferences. In 2022, it is going to be easier for SLPs to become certified as board certified behavior analysts. The BACB is changing things. When I got into the field of ABA, I was able to use my master's and as a speech therapist, and then take a course sequence, do my supervision, get my hours, pass my test. They have changed that and made it a bit more difficult. Speech therapists currently are needing to get another master's. But in 2022, that's going to change. So if you are a clinic owner and you're listening to this, just know that there will probably, I anticipate, more speech language pathologists becoming board certified behavior analysts. I get emails every single week from behaviorally oriented SLPs asking about my journey into becoming a BCBA. So just learn about your work setting. That's going to be super important. Learn about applied behavior analysis and common assessments given. So if you are listening as an SLP, knowing about some of the different assessments that maybe we as speech language pathologists can absolutely administer once we know more of these kind of basics of ABA and things of that nature. But knowing about the VB map. The VB map is a great, I was looking because I always have it right on my desk. I'm always talking about it. Having the VB map available for you to learn about. If you haven't learned about the VB map, it's really an amazing assessment tool. I have a free webinar on my blog about it. Feel free to email me if you can't find it on the blog. But people always want to learn more about that because we see that assessment a lot, and it really has changed the way that I've done therapy. I think I started giving it 8 years ago, and it really helps you get a scope and sequence of how to work with students who are having trouble with language. So understanding, what is the AFLS? The AFLS is another really nice assessment, comes from the behavioral world, and it is geared towards older students, looks at leisure and vocational skills and basic academic skills. And these are things that you can give collaboratively with a teacher, with a BCBA, and it gives you great information. Essential for Living is another really great assessment that I've been using. So for students who are getting older, who maybe don't have as robust of a skill set for the AFLS, they might be good for Essential for Living because it gives us really good information. Where do we go with this learner who's still having some difficulty with higher level language skills? And so if you are a speech therapist and you're in an ABA type environment, understanding that these are very important assessments, you're going to be seeing them and you should understand what they're all about. Does your company provide training about those assessments? Can you have access to those assessments so you can look at them and feel comfortable? Because once you're goal setting together with staff, it's going to be important to understand, we do our assessment and that's how we derive our goals for our intervention. That's a very important piece of the puzzle. So learning about ABA too, just common, does your company offer training and ongoing support? Because I think that's what we in the field of applied behavior analysis talk about, behavioral skills training. And so it's really this level of support. I'm going to show you something. I'm going to tell you about it. We'll practice it. And then I'm going to give you feedback on how you're implementing those skills. And that's really how you learn. And in the past, when I first started in the field of applied behavior analysis, that's exactly what they did. I took all the trainings, I role played, I learned, I worked with the students, and then my supervisor came and helped me understand, like, hey, you're doing this great. Let's think about this for these other areas. And that's really how you grow as an individual. You want that feedback. You want that support. Another thing to think about, provide information about the field of speech pathology in a collaborative way, or vice versa. So if you are having that disagreement moment with somebody and saying, you're thinking about things in a different way, either being a BCBA or you're the speech therapist, how can you share information from your field in a way that's collaborative in nature? Well, you could say, well, I didn't learn that in school, or we don't usually do it that way, but why don't you show me what you need? Why don't we take data on it this particular way? I'll do it this way and take data, and then we can analyze that together. I think when you take the emotions out of things and you say, like, okay, we're going to do this a certain way, and we're going to take data and we're going to analyze it, it kind of takes that emotion piece out of it. He said, she said, is it better to do it this way, or is it better to do this way? Let's provide therapy in a way that's going to help the student. Let's analyze the data, and then we can say, this strategy is going to be helpful. But there are definitely things from ABA, the field of ABA, and the field of speech pathology that we may not know about. So being able to share those resources, I think, is very helpful if you do it in a way that is collaborative and kind. Embed communication programming across a learner's day. So I think this is so important. Speech therapy services don't happen in a bubble. So if you're working in a robust ABA type center, they should really understand that programming for communication really needs to happen across a learner's day. So speech therapy doesn't just happen when a student goes to see the speech language pathologist or when a speech pathologist comes in to work with the student. It really needs to be cohesive. A registered behavioral technician needs to know what's going on if who is working with the student, or a one-on-one instructor needs to know, how are we working on communication? And that can look a variety of different ways. Shared goals. This is very important. This is why I put this slide in here. I had somebody say, how do we work together collaboratively? And there are a couple different ways to do that. I really believe that most goals, and it doesn't have to be everything, and this is really just me applying the science over the past 16 years, but shared goals help us create a narrow focus. So, we need to all know what we're doing. It goes back to that first part of let's build rapport with everybody on the team. Let's know what we're all doing. So when we're creating shared goals, that means that we would have the same goal. We'd be working from the same goal. Now, every state and every work setting may be different, but this is really here in my corner of the world where I'm applying applied behavior analysis. This is what we do for, I'd say 95% of the goals I have for students are shared, meaning when I see the student for speech pathology, speech therapy, if I'm the speech therapist, I'm working on the goal. The other times, it is being worked on by a one-on-one instructor. It's being worked on during teacher time. It's going to be called something different wherever you're at regionally, but I think it's so important that the student has multiple opportunities to work on their goal. So here's an example. Quinn will increase expressive language skills by labeling functional actions, a total of 10, with 90% accuracy over 3 consecutive sessions. That is our goal. So when I work with the student as a speech therapist, I'm working on that goal. When that goal is being worked on in the classroom, it's being worked on by the teacher or by a one-on-one instructor on the other days when the student doesn't have speech therapy. I think that's very, very important for our students' progress going forward. And so you can have a daily data sheet that kind of flows right into streamlining data. So streamlining data collection is very important too. So if you have shared goals, you can have a shared data sheet. So this is another thing that might be different from traditional speech therapy. One data sheet shared by all providers that the student works with. So potentially the student has a clipboard, and on the clipboard is their daily or every other day data sheet that is printed off. I do work in a place that uses data sheets that are, using pen and paper for. We had tried to streamline everything using an online data collection system, but it wasn't really meeting all the needs of the organization. So we went back to pen and paper. And so that is what we use. And that's really what I prefer. I like to be able to see everything that way. So one data sheet shared by all. So that might mean a student's IEP goals are put into a daily data sheet, potentially on a Google Drive, so that you can upload the occupational therapy goals if they have them, the speech therapy goals, any behavioral goals, academic goals. They're all kind of there at a glance. And so everybody kind of understands how to work on all the different pieces and parts. And then you can change those targets too as a speech language pathologist. So, let's say that we're working on that labeling goal for actions. As a speech language pathologist in an ABA type setting, once that goal has been set, I will give recommendations for what those targets will be. I will choose those targets based on my learner's motivation, potentially preferences, what's functional for my student in their environment, and things like that. If I have a student who's going to learn 10 actions expressively in a year and that's all they're going to learn, I have a big responsibility to pick those targets in a very mindful way. And if they're shared, you might want to talk to, all the other stakeholders, the BCBA, the teacher, parents, and those are things that you could even talk about within the IEP meeting, if that's set up like that, to be that kind of collaborative sharing time for you, whatever works for your organization, but that's very important. So this one type of data sheet, this collection, this way to get all that information is very, very important. I also on my blog shared a way to graph data, all within just kind of circling a bubble on percentage based on how the student does that day, if you're graphing, which if you're in a applied behavior analysis program, data should be graphed because it's giving us that visual analysis. So we're not guessing about how students are doing, how their progress is. We know exactly how things are going. So if you want that blog, send me an email as well. Streamlining progress monitoring. This is another very important piece to working in an ABA setting. So your clinic should have guidelines on who writes a progress report. Oftentimes, if a student is potentially going to an ABA center and maybe it's an outside placement, so this is the student's least restrictive environment, and this is where they're getting the bulk of their education, this is where their IEP is being implemented. There are going to be a lot of people if we're doing, a shared goals and things like that. So potentially the speech therapist working on goals, the ABA providers working on goals. We have to talk about who's going to write the report. That's important too. It goes always back to what are the role expectations. If everybody's working on it, who's going to be the person that enters that into the progress report? That may sound like something that's kind of insignificant, but it's not, because progress is very important. We need to report progress to potentially a school district, the parent, and it helps us as the team know, hey, maybe we need to work on this goal because it hasn't got addressed or it's only been run a couple of times. And when we're taking that daily data and we're graphing, we can analyze and say, this action labeling goal has only been worked on X amount of times this progress reporting period. That's not enough. And maybe we as a team need to say, like, why isn't this being worked on? Are there no materials for this? Are you unsure how to run this? We can really analyze what's going on during that progress reporting time. So that progress monitoring piece is very, very important. It's going to tell us a lot of things. Does our student need more targets? Do we need trained staff on how to implement and embed communication when they're not particularly in a therapy? Things like that are going to be very important. So streamline that progress monitoring. Access to behavior plans. This is very important. So if you're the speech language pathologist or one-on-one staff, do you have access to behavior plans? It's very important. Can you ask questions about the behavior plans? You should know exactly what's going on. If I work with a student and they display this behavior, then I treat it this way. But even before that, antecedently, I need to set up the environment a certain way. Maybe this student needs visuals. Maybe this student carries around visuals for functional communication training, if that they're working on a particular phrase. We need to make sure that, number one, we're always implementing behavior plans. And number two, if we have a question about the behavior plans, do we feel comfortable asking? And do we know who created the behavior plan? I mean, it should be on there. But those are all very important things you need to know. These are things that you absolutely need to know, because if you're working in an ABA center, you're typically going to be dealing with students who have behavioral barriers. So some of those behaviors may be unsafe behaviors. Do you have training, you should, on how to work with students who have and demonstrate unsafe behaviors? Do you have CPI training? These are things that you're going to look for when you're interviewing an ABA type center. These are things anywhere that you're working with students with problem behavior should be providing you to keep you safe, to keep the client safe, and to keep it a really positive environment. And you should have a plan. If you're working with a student who has behavioral barriers, do you feel comfortable implementing the plan? Do you have access to the plan? Is there staff available to help out with behaviors if you need things of that nature? Those are all really important things to know in any setting, but especially when you're navigating speech therapy services in an ABA setting. And then provide collaborative services. This is important, and we've been talking about this a lot, but knowing, can we, and we talked about how do we work on shared goals together? Myself, I've had students who were working on, I had these students who were working on more academic skills. So labeling and creating a sentence with a targeted word and things like that. And so we were working on it in a one-on-one setting. And then I would go into the classroom during a reading group time with a larger group, and I would run the group. And then I would have the one-on-one staff. They were there because the students did have some behavioral barriers to help implement behavior plans, but they were also there. I'm modeling how to work on these to embed the communication opportunities across the day. This reading group is something that happened every day. I was going in on one of my days where I was providing service, and I was modeling how to work on the IEP goals and take the data during this time. So I'm providing collaborative services, I'm modeling for the staff, I'm there to answer any questions, and that kind of FaceTime with staff is very important when you're modeling and they can ask you questions like, hey, I don't know how to run this, or what should we do if this happened? Being face-to-face with people really makes it easier just to have a relationship with them, become friends with them, and to help with this collaborative services. I've also had students where we're working on modified leisure skills or conversation skills, and maybe they practice that in a one-on-one session. And then once a week, I do a small cooperative group where we work on conversation and we work on modified leisure skills. And then that's a time for them to generalize that skill to that group setting. So they may be taking data a different way, and then we work on generalizing it because we're always planning for generalization within that different type of group. So that's just an idea. Or maybe somebody's working on skills in a teacher time, a one-on-one instruction type way at the table. And then maybe somebody else is working on that same skill in a natural environment teaching session. Okay, so there's all different ways you can provide collaborative services. That's very important. Communicate with parents. Hopefully your center or wherever you're working has a standard protocol for how you should communicate with parents. Oftentimes it's, a sheet. How was your day? Did they have speech therapy? Maybe you write your own note. But knowing that if you're new, if speech therapy is new to that clinic setting, that might be something that you need to set up. But knowing that communication with parents is so very important, especially if you're working with a student at an outside placement, an ABA type center where maybe they're getting all of their academic and related therapies. The parents are really going to want to know what's going on. I see that you guys are asking questions, which is great. I'm going to answer those questions at the end. Okay, so I will definitely get to those if that was a question. Communicate with staff. So very important to communicate with staff. So one of the ways that I try to communicate with staff is to talk to them face to face. So when I say communicate with staff, if I'm a speech therapist in an ABA program and I have a daily data sheet and everybody's working on my goals and communication is embedded and that's all in place, the way that I want to communicate with staff is I was doing for my students, I'd have a Google Drive, a Google document, and it would say so-and-so's name, these are the goals, these are the targets. So I would kind of check in. Every once in a while, too, I was doing a book review because any good applied behavior analysis program is graphing. So I could say, oh, you know what? So-and-so's mastered all the recommendations I've had for this. Let's go back to our labeling goal for actions. They've mastered all 5 that I had listed. Okay, that looks really great. They're learning them very quickly. Okay, let's do these next ones. And those would be my ideas. And I would add them to that Google Drive, that Google document, and I would share that maybe with the one-on-one staff or the teacher or the BCBA, however your organization is set up. But that type of communication is very, very important. It's important to be able to communicate with staff. If you don't have the time to communicate with staff, what I've done before is made a video and uploaded it to a Google Drive, or uploaded it to a YouTube as a private video or unlisted. And so only the people who care about that particular thing could watch that particular video. However you do it, I just try to make sure that I'm communicating with staff, whether it's a phone call, if it's face-to-face, if it's some kind of remote way. It's important to make sure that we communicate with staff. If you're trying to work on communication targets, but for 3 weeks, you haven't been able to talk to anybody, they may not be working on your goal because they have a question, or they need a new target, or whatever it is. You don't want to hinder progress because you're not communicating with staff. That's super important. And I think a little different than a traditional speech therapy. So ways that I can help. After I go over this, I'm going to get to questions. I do have our company, ABA Speech, is an ASHA-approved CE provider, which is important for speech language pathologists because they like to get ASHA-approved CE credits. We do have a course called Help Me Find My Voice, which is a 5-hour ASHA-approved course all about working with early learners, not just young kids, but anybody who's having trouble finding their voice. And I talk in that course a lot about ABA. I talk about the BB map, the verbal operants, behavior plans, ABC data, things like that that are kind of the basics of ABA. And so I'll send everybody who registered today, I will send you this replay with these codes and links should you be interested. You can use ASHA 26 and pay just $99 for the course, which is savings of $26. So with the course now I'm offering right now, you can either choose the Action Builder cards or this is double up when you register. Shipping currently is only in the United States. I apologize about that, but that's just kind of how it is. It's hard for me to ship internationally. So when you sign up, you get the course and you get to choose either the Action Builder cards, which are 100 therapy flashcards, or you get to choose Double Up, which is a game, which is geared towards students, I'd say 3rd grade and above, even adults. It's a really nice game. When you enter the course, there's a private Facebook group. This is the group. You can only be in this group if you are in the course. And I actually just went live in the course. I go in live every single month. I answer questions. I do a live video every single month and talk about the modules or answer anybody's questions. So it's nice to have that community. We have over 100 people in the course Facebook page now. So it's nice, people from all over the world, literally. It's really cool. I have those monthly office hours. I also have, I just started this free consultation, and I have a paid consultation. So I have an hour every week where I'm doing a free consultation. I'll send you the code. It's just a 15-minute time slot. So if you have questions about becoming a BCBA, if you are a clinic owner and you want to ask me some questions, you know, whatever it is, I have that free 15-minute block. I can't give you information that's individualized to different clients because that's unethical and things like that, but it is there, it is available. I have a calendar link, you can sign up. And if you want to do more of a paid consultation, I do offer paid consultations, and I have done that for speech therapists here and speech therapists internationally. They're working in ABA centers. I've talked with clinic owners who are implementing speech therapy services and things like that. So just to let you know, those are ways that I can help. I'm going to stop my share here and answer some of these questions, if any of these are questions. Okay. Okay. If anybody has questions, none of those are questions. Thanks for telling me where you guys are tuning in from, kind of all over, which is exciting. But if you guys have any questions, feel free to type them in the chat and I can answer them here. Just as a recap, I will be sending you a webinar replay. I will send you a link for the course I discussed, which is a really nice course for anybody who is new to the science of applied behavior analysis, new to working with students who have behavioral barriers. And I will send you those links if you want to sign up for a free consultation or a paid consultation to kind of help go deeper on some of these topics that I've discussed here. If anybody has any questions, feel free to put them in the chat and I will answer them. Thanks so much for tuning in, guys. It was really nice. This is the next best thing besides face-to-face. Do you think it is necessary for a SLP to be ABA certified or to be certified as a BCBA? I don't think that it's necessary. And actually, ASHA is coming out with some type of autism certification. It's in very early stages. So if you are listening and you're a clinic director, that might be something that would be nice for you. People will have to have certain competencies and I believe take a test, but I'm not 100% sure on that. But that is something that I think is coming down the pipeline. So I think that is important. I do think it's important for speech language pathologists to learn about applied behavior analysis and learn about autism in general, with the incidence of autism being 1 in 59. When I first started a long time ago, seemed like a long time ago now, I would give talks and I'd say 1 in 200 and something are diagnosed with autism. Now the CDC is saying 1 in 59. Somebody said, I have a new placement in middle school and high school with 6-unit classrooms. Life skills autism, is your course good for older students that are nonverbal and early learner levels? Yes, it is good for that. And I myself work primarily right now with students who are in middle school and high school. So I like to give those type of examples when I'm talking about things. And that double up game would be really great for that, because I created that game because I was having a lot of students who couldn't get past matching picture to picture. And that really kind of stunts a lot of the things that you can do for leisure as you get older. And a lot of the things that were maybe on a student's level were not developmentally appropriate, or they just weren't age respectful. I think real life pictures are where it's at for all students with autism, but I created that because I have a lot of students I care about who are older, and I wanted them to be able to engage in leisure skills that are dignified, you know, and in talking about important things. Good, thank you. I hope that you guys sign up. Really good question. So yeah, when I say early learner, I just mean anybody who is having difficulty finding their voice. I've worked with students who were unfortunately 18, didn't have a way to communicate. Once they got into a program that was utilizing ABA, they really were able to use a device and tell us things they wanted, and really kind of get some autonomy back in their life and control of their environment, and not need to do that by using behaviors and by using communication, which is really powerful. So if anybody has any other questions, let me know. Thanks for tuning in. If you think of any other questions, just respond to my email that I'm going to send out with the replay. I'd be more than happy to answer them. And hope you guys have a good one. Talk to you soon. Bye.